Mr. Smith is a 54-year-old finance professional, but a menu clinic today, complaining of pain from one of his upper front left leg, which is also wobbly. The patient has hypothyroidism, oral pain, and GERD. He is taking thyroxine, immediately ashen. OPT reveals bone loss along low speed. The report has bone loss of around 80%. And your chart shows probing depth of 6, 7, 8 mm by almost speed. Taking as many and patient does not fall potential alcohol. They address the patient's concerns and give the shock at a term management and give appropriate management.
Here, the pointers would be that we have to highlight the importance of the periodontal disease, discuss the risk factors and prognosis, and discuss management options and emphasize on specialist referral. Let's dive into the role play now. Hi, Mr. Smith. Thank you so much for letting me have a look at your teeth. Just have a seat and we will now discuss about what we have seen so far. Are you doing okay?
Yes.
That's good. What sort of pain are you in at the moment?
It's more of, discomfort than pain.
Okay, yeah.
I've problems with your talk and I'm not able to, eat in front of people. I'm very still and I'm going to eat something and the tooth is going to fall off. And now it has speed because it keeps moving and I meet a lot of professionals and I'm very uncomfortable.
Right, okay. No, I can imagine that's really not something that anyone would want to go through. But you're here now. Let's definitely help you out with this. That's yeah. So now what I have seen after from the pictures and also the radiographs, the x-rays that we have done today, and also if you remember, I was using an instrument to just measure around your teeth as well. I was just telling you that this might feel like I'm poking around those teeth. So I've got a few findings now from all this. So what you have is called as periodontitis. So and yours is a little bit of an advanced stage as well. So it's stage 3 grade C periodontitis.
Okay.
That's what we call in our dental terms. So what this is basically advanced gum disease. So there are several reasons why this could have happened. I am just recapping your medical history as well. I know that you're taking thyroxine and you're on vitamin D and some calcium supplements. And you also do have a little bit of acid reflux. Is that right?
Yes.
Yeah. Yeah, so your medical history appears quite straightforward. It does not look like, any of these could be contributing to this advanced gum disease. But there are other factors, such as maintaining good oral hygiene. So even if there was a little bit of a lapse of oral hygiene there, that could lead to the plaque going down all the way through the gums.
I do brush twice a day at falls and like the day, I've been coming. I've been maintaining my teeth. Then why is this happening?
That's very good. That's very good. And it's actually important to then look at other factors as well. So oral hygiene, yeah, like I said, is another factor, which in your case, you're doing everything right. You're doing all the right things and you're keeping up with your appointments. You're doing really well. But it could be that it's a genetic cause as well. So do you know if anyone in your family have had a history of early tooth loss?
In fact, is the
All right, yes. It could be a reason. Again, we can't pinpoint and say that is the main cause, but it could be a reason there as well. So all these things can lead to the weakening of the support that these teeth have from the tissues around it. And when that happens, the plaque, the bacteria, they're all going to sit through the space between the tooth and the gum, and that's what we call as a pocket. So today, if you remember, I was using the instruments to go around those teeth and I was calling out numbers to my assistant. I was saying 6, 7, 8. So what we're talking about is that those are the measurements that I have now detected as a pocket in your teeth. So that is why we now really have to address this concern as soon as possible. I also just wanted to double check with you. You don't smoke or drink?
No.
Have you ever done either of these in the past?
Yes, I have. But no.
All right. So how long was it smoking that you were doing in the past?
Yes, I used to smoke and I used to drink, and then now I actually realized it's not good for my health, and I slowly stopped it with help of my
Okay, that's great. That's fantastic. Good on you. Not many people actually reach a stage where they're able to completely quit smoking. So you did exceptionally well there. Fantastic. But how long have you been have you had smoked for?
I started smoking in my late teens, and I probably was smoking till about 5 years ago.
Okay, so it's a fair bit, a few years then. Yeah, okay. Now, so even if it is historic, smoking is also a very big risk factor. So what it does is it masks all the symptoms that happens in our mouths. So it actually reduces the blood supply, and it can really affect our gum health. So again, this could also be a cause for what we are seeing today. But it's good that you're not doing this anymore. So at least we have cut out one risk factor from our list right now. So that's pretty good. So now what we should be looking at right now is we have to think about how are we managing this today. So my suggestion would be that either way, we can't guarantee the longevity of that tooth, because if you look at the image here, right here on the X-ray, this darkening area that you're seeing there, it is all the bone that's lost around the tooth there. So which means long term, this tooth may not stay in its place there. So taking it out is an option to relieve you of your discomfort. After that, we can then send you to a specialist to make sure that this condition is stable and it's managed well. And from there, you can consider having replacement options for these teeth.
Okay. So, what do you suggest? I don't want extraction, so how do you suggest we go forward?
Right. No, I completely understand. They are your front teeth, and most people would be very unwilling to have that done. So, because we are trying to salvage whatever is left here, we can definitely try and put a wire around those teeth to stabilize it and to make sure that it's not uncomfortable when you're eating food, or, when you're biting on anything. I would obviously not suggest eating hard food at this point. Soft diet is the way to go for a few days or months at least.
I'm always feeling, yeah, then definitely.
Yes.
So it and everything follow.
Yes.
And obviously each was like back teeth, and
Yes.
so one lose and one teeth if you're saying that this is genetic and one by one or maybe that
That's right.
it doesn't look good on a professional front as well.
That's right.
Those
Yes, I completely agree with you. And so that's the reason why we should be doing that today. And I will also give it a good clean around your teeth around that area. And we'll also just use a little bit of saline water, flush it all out around there. And even after we finish with the treatment today, you must follow the same protocols where you are, gently rinsing and having a soft diet. And once you see the specialist, you can discuss your concerns and your goals with the specialist as well. And they will be in a position to help you with future outcomes for this tooth. So you will be given some options of replacement once your gum disease is stabilized. You can look into having a plate made, or something more definitive would be having either a bridge, or depending on the level of bones that you've got there, he might suggest that we could put in a screw, which is called an implant as well. But all this is long term for you, so we do definitely need to focus on stabilizing the gum disease.
Well, worried your periodontalist helped me by saving the tooth. Is he gonna be able to save the tooth?
We will hope that he can. That's probably what he will be trying to do as well. But like I said, once we have lost all that support around the tooth, he will also probably tell you the same thing, that this tooth has a guarded prognosis. So we are all going to aim towards the same thing, try to save as much as we can, but he should be in a better position to lead you through it.
Okay.
Do you have any other questions for me, Miss Smith?
So still quite a lot of fats that and my views in it.
I understand it is hard. It is hard for us to imagine these situations. And I know that you are a busy professional, so this will impact your lifestyle. But the good thing is you're here now and we have all the information that we need and we have a plan in place.
Yes.
So we should really be able to help you out with this.
Yes, I hope I can see a specialist soon and deal with.
Yes, absolutely. We'll get that started. So would you like me to go ahead and start off with cleaning the tooth?
Yes.
Yes? Okay.